Good afternoon, everyone, and welcome to NHS Shetland's annual review for the year that ended on the 31st of March this year. It already seems like a long time ago. It was another busy and challenging year for NHS Shetland, and the hard work and resilience of our staff across all of our teams has really stood out, with everyone trying their hardest to do what is best for our patients and communities. We're going to take you through some of the important bits of our work in the organisation that happened between 2023 and 24, have a look at some of the performance data and information, and highlight some of the work teams have been doing to maintain or improve on that performance to make outcomes for people in Shetland better. We will also touch on some of the challenges we are facing as we go through the presentation. I'm going to take us through a summary of challenges and highlights to begin with. Then I'll hand over to our Chief Executive, Brian Chittick, to highlight some more detail on the different areas of work. We can't possibly hope to tell you about all of the good work that has happened over the course of the year, but we hope these highlights are of interest, and we'd really encourage people to get involved in following our board meetings and social media feeds to hear more about what's going on throughout the year. There are a number of challenges we've been facing for some time, and these are mostly shared with boards across the rest of Scotland. There are also some great pieces of work going on to help us overcome or mitigate these challenges. A lot of things are changing, and many of the pressures we are under have been building over a number of years. While we are doing a lot to combat these challenges, we need to adapt more quickly and on a bigger scale to have a chance of thriving alongside these challenges. We know that our population is changing. We have an increase in older population, and we have a decrease in working age population, which is part of our challenge in sourcing staff. An older population generally has more health and care needs, so we're seeing a demand on a lot of our services increasing. People's needs and illness are always evolving as we find new ways of looking after people and managing conditions, and things change and evolve in society. We see different trends in illness and complexity. We need to adapt to understand and meet people's needs. Sometimes these are different in Shetland compared to other places. Our workforce is changing. There are big gaps in particular trained workforce across Scotland and the world, meaning we have to adapt to find new ways of recruiting and new ways of delivering services. People working for us have different needs and different ways of working too. The public sector as a whole is under pressure, and this pressure has been building for a number of years. With constraints on finance in the face of increasing demand, this means we have to adapt quickly, but it also means to excellent teams we are to change and adapt under considerable. To have excellent teams, we are asking to change and adapt are under considerable pressure. While we adapt and change to try to overcome these challenges, we do see them impacting on our services and the quality and timelines of care we can give our patients. Some big areas where we are seeing this pressure having an impact are across cancer services, getting people home from hospital or delayed discharges, dental services, psychological therapies, waiting times, hospital buildings maintenance. There are also some areas where, in spite of these challenges, great work is progressing. A few of these include primary care, where we were a chosen site for a big project working to improve the care and support we offer in health centres, planned or elective care, where our teams are building pathways, networks and relationships to find the best options for Shetland patients in a Scottish system that's under pressure. The opening of a bereavement suite for those experiencing pregnancy loss, named Northern Star, has been a much needed addition to our hospital locally, and is a credit to the hard work of our maternity and estates team and the support of our local third sector partners in the development of an appropriate space. Taking the time to understand our population, to do what's best for Shetland, we really need to understand what Shetland needs. We have been working with our information analyst colleagues community planning colleagues and public health teams to better understand needs in Shetland. The MRI scanner, our local community did a huge amount of work fundraising for a local MRI scanner, and our teams have made this a reality. There was an enormous amount of planning and preparation in 2023 and 2024 to help us to go live earlier this year. Development of a local oral health strategy is another good example of local teams advocating for Shetland needs, where a one-size-fits-all approach doesn't work for us. There is still a huge amount of work to do, but getting these foundations in place is an important step forward. Keeping services running under periods of pressure, we have seen periods of extreme demand and also extreme weather as examples, both of which could quickly overwhelm a small system. But working together with all our partners and making strong decisions under pressure has helped us through these difficult times. As well as this work within our teams and services, we've been laying some foundations as an organisation to support the changes we know need to happen over the next few years. This has included the development of our strategic delivery plan, which builds on the existing clinical and care strategy, and also our digital strategy. We know digital is a huge part of our future, and we want to make sure we are optimising what we have and making the most of upcoming opportunities. This strategy, built on engagement with our teams, should put us in a good position to do both of these things. But strategies on their own cannot make change happen. Brian and his executive team have been working to embed the Chief Executive's objectives for the organisation that include but go beyond these strategies, setting out where the big pieces of work and ways of working that will help us to get to where we need to be. Our new strategy aims to focus attention and efforts on what is important to people, what we know will make the biggest difference in the long term, and what we need to do to protect our services and make sure we are fit for the future. These three big objectives are, firstly, to deliver excellent services, secondly, to support the building blocks of health, and lastly, but by no means least, to create the conditions for a sustainable organisation. I'd like to hand over to our Chief Executive, Brian Chittick, at this stage, who is going to take us through a little more of what these objectives mean for us in Shetland, and then on to discuss some areas of performance from across the organisation in 2023 and 2024. Thank you. Over to you, Brian.
Thanks, Chair, for the introduction and the overview. And as you said, I'm going to delve a little bit deeper into the three strategic objectives. And the first one that we're looking at is supporting the building blocks of health. And this is an important perspective. It's got a population and public health perspective round about it. And it really is thinking about what determines poor health and poor healthy outcomes in our community. Because we all know that good health outcomes isn't just built on the NHS and the services that it provides alone. We do a great job treating people when they become unwell, as well as supporting people to prevent becoming unwell. But really, our health is shaped by the world around us and our community that sits around us as well. Factors like economic factors, wealth, education, housing, environmental factors. These are factors that we might not be able to influence directly, but we can certainly work with other agencies in Shetland to ensure our collective efforts get the best outcomes for people living in Shetland. And that's where all our partnership working comes into play. Supporting the building blocks of health also revolves around the impact our organisation has, like looking after our staff and becoming a positive influence in our community. Because these are the real things that are the route to prevention and better healthy outcomes for our community. These are the things that will protect the NHS and make us more sustainable. And these are the real things that mean people will live well, connected, thriving lives. As we say at the bottom here, the NHS was never meant to go alone, and our strong links and partnership working means together we can make a real difference. The next strategic objective is excellent services. Having been out and about in our organisation and listening to our fantastic staff, this is why they come to work, to make a difference and do the best for our community. Whether this is staff on our clinical teams on the front line, our admin teams supporting them, our states and facility teams making sure everything is safe and functionable, Our support teams like HR and digital, making sure we're connected and the information is available at the right time. Also that we have the right staff available, as well as our management and leadership teams, making sure this is all safely and effective and efficient. I want to ensure that NHS Shetland is listening to our patients and our community, both in our one-to-one interactions and when we are planning for the future. We want our care to be safe, appropriate and tailored. And the only way we can do a lot of this is by knowing what matters to you. We want to ensure access is fair and equitable, and that this doesn't mean the same for everyone, but because everyone has different needs, it means you get what you need when you need it. And by taking this approach, we can focus on the people who need us most. The third objective is creating conditions for sustainable organisation. As a health board, we have a responsibility to deliver services and support within our means and within the budget and workforce that is available to us. This is becoming increasingly difficult and challenging in the current system that health boards operate in. We want to be a stable and sustainable organisation, but this can be tricky, particularly as an island health board, where we know costs are higher, the cost of living is higher, there's more challenges to attracting workforce, and there's a reliance on mainland boards for some of our services. But we need to adapt to meet the real challenges. We need to make the most of the opportunities available to us, including digital innovation, technology, as well as developing our workforce and ensuring they are a workforce fit for the future. So how are we performing? For us, performing well is not just about seeing as many people as quickly as we can. Waiting lists give us valuable information, but doesn't tell the whole story about us performing as a health board. We are really working hard to give a more rounded, balanced view of performance, as well as the national measures we regularly track and report on. We are also focused on a balance of qualitative and quantitative data to annotate how are we doing. The qualitative aspects is about hearing the story from our patients about their experience of our services. I'm also going to share some data and numbers about areas like waiting times and how we are performing, and this is the quantitative part of our performance management and monitoring. The key to understanding performance is understanding what we are trying to do in the first place. And to know if we are performing well for our community and our patients, we do need to understand what matters to you. After developing our strategic plan, we've spent time checking in with our teams and our community that we all feel we're heading in the right direction. As part of that, we have taken NHS Shetland on the road around places like our country shows to ask what matters to you. It has been a great opportunity to reflect on the excellent services our teams are providing and to hear that from our community, but also to hear that the areas we want to improve are also areas that people highlighted as being important to them as well. So what we have heard about what matters to people, it's things like access to healthcare, both how quickly you can access as well as how, in what manner you can access our pathways and our services. Communication and personal touch. People value being seen and listened to as an individual, having clear explanations, and the importance of communication between services that patients might need to engage that might be out with Shetland. Quality, fairness, community and teamwork all speak for themselves, but important to highlight is things like trust and reliability, being able to trust our organisation and knowing we are there when you need us was a really important piece of feedback as well. We'll be taking this feedback and information to develop our performance monitoring and management moving forward. Our aim will be to incorporate more experience measures into our performance reviews in the future. As I've already touched on, our financial position will influence our journey to being a sustainable organisation. One of the big challenges for us is our spend on our workforce, and in particular supplementary staffing, which includes locum and agency staff, and these are the staff that cover gaps and vacancies in the short and medium term to ensure that we can sustain safe service provision. As you can see, we have seen a decrease in our spending, but it is not enough. During the last year and into this year, we are working to understand our workforce needs better so we can make a bigger impact on this spend. We've been looking at improving the use of our staffing, innovative options like grow your own and international recruitment, as well as flexible working, alternative delivery and associated staffing models, and different mixes of staff, skill mix, and expertise in the workforce. We've got to say the workforce problem in healthcare is a national problem and not just limited to Shetland, although, as I've touched on, some of those problems and those challenges are exacerbated working as an island health board. However, just want to provide that reassurance. We're pulling together our workforce plan for the next 3 to 5 years, which will help making our workforce more sustainable in the future and encompass a lot of the elements I've spoken about during this slide. One of the ways we can become more sustainable is by working better together, optimizing all the strengths and assets Shetland has to help people live and stay well. We're involved in a number of partnerships locally, regionally, and nationally, with a lot of team members dedicating a lot of time doing work in these areas. Locally, within the Shetland Partnership, we lead on 2 major programmes of work: Person-Centred Shetland and Climate Change. We're also heavily involved in others, including Compassionate Shetland, which looks, amongst other things, to challenge stigma across our community. Good partnership working decreases duplication and increases synergy, and helps support better outcomes for people. We have also a strong relationship with our third sector and other agencies like Scottish Ambulance Service, Scottish Fire and Rescue Service, and the Shetland Islands Council, to mention a few. We know that investment in early years of time, attention, money sets our children to have better outcomes throughout their lives. Recent research annotates that £1 spent in early years saves £7 across someone's lifetime. This is about investing in not just our future, but that of our community and our children and young people, and setting them up to thrive. A couple of universal services we need to make sure we pick up on issues are health visiting and dental checks via our Child Smile programme. We're doing well in terms of access to both of these vital services and programmes. We're, of course, a key member of the Shetland Children's Service Partnership, providing leadership and planning support, as well as having a number of services involved in this partnership. This year, we will also be working towards developing our NHS Child Health Strategy. One of the priority areas in our strategic delivery plan is urgent and unscheduled care. This data tells us about you being able to access what you need in an urgent or emergency situation, and we are wanting to provide timely, safe, and quality care. We look at the whole journey from accessing your urgent care support to getting home again. We're generally doing well at seeing people quickly in A&E, and every time someone waits longer than 4 hours in our 4-hour target, we investigate this on a case-by-case basis to understand what has happened, and we're always trying to improve the services that we provide. We also have some nuances in Shetland which we understand, which increase our waits in accident and emergency. Some of these are like waiting for a transfer to the mainland, or providing care in accident emergency to discharge people home as quickly as possible and to avoid admission into hospital. All this takes some time. One of our strengths in Shetland is how our hospital and community teams work together to plan, to manage patients being discharged from hospital, ensuring they get the support they need to remain at home. This good planning means we have relatively few emergency readmissions back into hospital. Urgent and unscheduled care by its nature is unpredictable and can put a lot of pressure in our system at quite a short period of time, where there are spikes in demand. And in Shetland, this always isn't in the winter. Summer activity in Shetland can put our system under extreme pressure at this time as well. We are undertaking a wide range of improvements to help at managing these spikes in demand and make sure people are cared for in the right place by the right professional. Some of this improvement work includes A hospital at home pilot, again, using good relationships we have between our community nursing and acute medical and nursing teams to provide a level of hospital care at home for those patients that are appropriate for this pathway. It keeps care as close as home to possible, which is often what our patients want. Working closely with Scottish Ambulance Service colleagues, providing advice and support to ensure that they can treat and support more people at home in our community, connecting patients to community services and decreasing the number of patients being transported to and being admitted to hospital. Improving out of hours care in our primary care and community settings. In 2023-24, we trialled a mix of advanced nurse practitioner and GP model for out of hours cover on mainland Shetland. This was a great success and decreased the need for locum GPs just to cover our out of hours, and we'll be looking at how we expand this pilot next year moving forward. Also, we've been focused on joined up discharge planning, which is good work between our health and social care teams to discharge and plan for discharge effectively. We're also improving our future care planning for people with health needs to anticipate and plan in case something happens, and we already know what the patient wishes and wants, as these have been discussed in advance. Planned care is more predictable and urgent and unscheduled care, but we are seeing an increased demand which is becoming more challenging to deal with the resources we have available. We are seeing longer waits to see a specialist, something that is becoming increasingly more difficult in all areas of Scotland. On the whole, we are performing really well in our planned care data that we capture and our planned care provision. We're also managing some challenges around cancer waiting times and the 62-day target. The aim being that there's no more than 62 days between your referral being received and your treatment starting. This process has a lot of different steps, investigations and decision points. We are particularly struggling with some of those steps that happen out with Shetland. We are doing work to combat the problems we currently have. In Cancer Pathways, we have one of our team who is dedicated to tracking all Shetland patients through the whole process to ensure waits are as minimal as possible and to help our patients navigate some of the complexity to make patients' journeys as smooth as possible. We are working with our GPs and our other referrers to ensure that those who need really quick access are prioritised and their delays minimised. Our teams have also been working hard with other health boards to get the best treatment for Shetland patients, whether they have to travel or have visiting services come to Shetland to provide care. And this year we'll be undertaking an initiative called Waiting Well, supporting people better whilst waiting to see a specialist or waiting for treatment, using national resources to help people get better faster after treatment. Shifting the balance of care in our context means moving care away from hospitals towards communities and people's own homes, literally care closer to home. This slide tells us about how well our system is doing, whether it is a good number of people living in their last 6 months at home or decreased amount of people being admitted to hospital multiple times because we are supporting people better and well and they are not needing hospital as often. The bottom two measures come from the National Health and Care Experience Survey, which shows the feedback is really good for our teams in primary care. We also run a number of local surveys at our health centres, which I know a lot of patients complete, and we're really grateful because all this feedback goes to shaping our services in the future. Shifting the balance of care is one of our strategic plan priorities, which also involves partnership working with our Health and Social Care Partnership and our Integration Joint Board. A few highlights of work in this area is improving our primary care data to help us manage people with long-term conditions better, focusing on making sure you can access primary care in a way that suits you and that you can get what you need in the best place for you. Helping people stay well. This is work like the work that our health improvement team undertakes with programs like Otago, which is our falls prevention program, or Why Wait, which is our healthy weight program, and helping people stay connected our community link worker pilot in Bray and Walsall, connecting people to what they can get for, support-wise from their own community rather than the need to access services. Mental health and well-being is a really important area for us. This slide shows the data we report nationally about psychological therapy services, CAMS, and substance use and treatment. We're doing really well in CAMS and substance use treatments, and we're also improving in the delivery of our psychological therapy service. Whilst we're having more patients referred to psychological therapies on a monthly basis, our improvement in performance is also improving. When compared to the rest of NHS Scotland, we are in the middle and very close to the national average. But we must really take note that this is way better than where we were a few years ago when we were well in the bottom quarter for performance in this area. We also have a lot of work underway across all of our mental health services to ensure our services are safe, accessible and effective. We're looking at the data we collect to understand what we need for the future. We're continuing to work with our fantastic third sector in providing support and services within the mental health spectrum. And we're also continuing to provide services in a way which patients want to access their services using a blend of digital, face-to-face and group service provision. We are working to improve access for those using substance recovery services. For example, one of our local advanced nurse practitioners has been working closely with our recovery hub, supporting and treating people who may have barriers to accessing services, and supporting and connecting them back into our universal services that we provide. We are also supporting teams to work in a trauma-informed way that makes it easier for people to get the services they need, the support that they need, all in a compassionate way. But of course, good mental health and well-being is not just about the services we provide. This is just a small part of what makes a difference to our mental health and well-being. All parts of our daily life impact on our mental health and well-being. There are also things shaped by community and society that has impact on our mental health. In 2023 to 2024, our public health team undertook a Good Mental Health for All project. This was a huge engagement and research project working with people from all walks of life and all ages across Shetland to understand what would make a difference in supporting our mental health and well-being here in Shetland. The full report is online, but this slide shows a brief summary of the factors that people felt would support mental health and well-being. Help with the cost of living, help with living well, help with the poor weather, more things accessible in our communities and in place, less stigma and discrimination, better personal connection, more education and literacy, a change in life expectations, better relationship with self. We are now moving forward with developing a population mental health and suicide prevention strategy in partnership with all those other agencies and networks in Shetland. We look forward to discussing that next year with you all. I'm now going to hand back to Gary for the conclusion of our presentation.
Thanks, Brian. And finally, a brief look at the situation with our health buildings and infrastructure. Many of you will have heard in the news and followed the progress of our programme initial agreement that was underway in 2023 to 24, which a great number of our staff put a lot of time and effort into. Unfortunately, the programme was paused towards the end of the year by the Scottish Government as financial challenges escalated. This was really disappointing for us as an organisation. We have the oldest acute hospital in NHS Scotland, and the challenges with maintaining that to a safe standard are visible to anyone accessing the hospital. We also have challenges with buildings and space in our community assets, which were included in the previous process. There are real challenges not only for patient safety and quality of care, but also around redesign and staffing. Having to use the old spaces that are not entirely fit for purpose means some of the changes we would like to make are not possible. While the pause in the programme was disappointing, the work was not wasted, and it's been used to inform the whole system infrastructure plan that all health boards are working on for the Scottish Government this year. and we expect a review to take place in December, when hopefully we might learn if or when we can restart the programme. I'm certainly of the view that it is still a case of when and not if we see a replacement for the Gilbert Bain Hospital. That takes us to the end of our annual review for this year. So thank you very much for your time and for your ongoing support for NHS Shetland and all of our excellent teams. Of course, there will be things we have not been able to mention. We couldn't squeeze it all in, but we would really welcome any feedback or views on what you would like to hear more about. And I think with that, I'm going to go into the question and answer session. We're not able in this session to speak about individual cases for obvious reasons, but we have a number of questions, broader questions that we have been sent in, and we look to get answers to those. I think we've got everyone with us today that can answer the questions, and I'm going to start off first of all with a range of questions that have come in about long COVID and how a hyperbaric chamber might be able to assist patients suffering from long COVID. So I think there's a range of questions here really asking about support for long COVID sufferers in Shetland, support for children and young people living with long COVID, ME and chronic fatigue, and also asking why Shetland is one of only two health boards in Scotland not to have a long COVID strategy. So I think Kirsty and Susan are going to take those questions, and then I'll come to the final one in that area around the hyperbaric chamber. Kirsty, can I come to you first?
Yeah, thanks very much, Gary. So just firstly to say that, if you're suffering with long COVID, you absolutely have my sympathy. It is not a pleasant thing to have, and nobody has chosen this. It's obviously hit people very hard, and as a GP working in Shetland, I have witnessed some of the folks who are suffering from it. So absolutely feel that these are really good questions. Shetland is a really small health board, and our services are often single-handed or very small. So in terms of having a dedicated team for long COVID, I would say that probably would not be possible. However, we absolutely support people with long COVID with the services that we have. So rather than having a dedicated service, we have generalist services who wrap around those people as they require. So that would include the consultant physicians who would be assessing people with breathing problems. We have occupational therapy and physiotherapy to support those who are managing their symptoms long term, and obviously primary care plays a big role in there. So I think that's our strategy. In terms of a dedicated service, Grampian and NHS Highland do have those, and we can refer patients as required if that's something that would support them. I don't know if, Susan, you want to come in further on long COVID and vaccinations and prevalence?
Yeah, there was a report recently published by the Lancet which looked at prevalence of long COVID, and it was suggesting that there's maybe sort of 1 to 2% of the population would be affected with long COVID, and that's defined as having symptoms for 3 months or more after having the acute infection. And of those people, about 70%, nearly 3/4, would probably have symptoms for more than a year. And some people have them for much longer than that, but other people do recover. There is evidence as well that people who have been vaccinated, who've had their vaccinations, are less likely to get long COVID. So I think quite a lot of the people who are suffering particularly badly are ones who unfortunately contracted COVID in the earlier stages of the pandemic before we had the vaccination programs. So I think going forward, it's really important that people do take up their offer of vaccinations if they're offered, because they will, as well as protecting from serious illness with the acute infection, it does seem to help with not developing long COVID going forward. So I think that's something important to look at. And also there's something about the people who are particularly vulnerable and therefore eligible for COVID treatment in the community should access that treatment if they develop COVID infection, because that can help as well to prevent long COVID going forward. But I think, as Kirsty said, in the management, like many things in Shetland, we can't have specialist services, but we do manage the issues related to long COVID on a needs basis, because everybody's quite different and has different needs, and they may range from things like self-management to physiotherapy to more specialised input, perhaps around heart conditions, etc. So I think it's important to recognise that there are various different elements and different services that people with long COVID might need, and we try and meet those in Shetland through a range of different services, just not one that's sort of labelled as long COVID.
Thanks, Susan. And I suppose just to come back, because I think something of what I heard from the question was a need for some peer support, and that seems like a gap. So in terms of a sort of support group locally, I'm not aware of one. And if that is something that people feel would be helpful, I suppose I was wondering about our community hubs and whether there is a place, because we do have support groups for other, so when I say we, I mean Shetland as opposed to NHS Shetland, have support groups for other conditions, and there are various people around who know how to do that sort of thing. So I wonder if the community hubs might be a place where people might start to talk about that. And then just your specific, I know we're taking a lot of time, sorry, Gary, your specific question around hyperbaric treatment. So there is some evidence that people with long COVID have some benefit from this type of therapy, but the studies are really small. And therefore, at the moment, there isn't sufficient evidence for hyperbaric therapy to be included in any treatment pathway within the NHS. So when we look at new treatments, there is quite a process for those things, even medication, to be accepted into standard treatments. So these things require quite a lot of testing, and evidence levels are set quite high. So at the moment, it's probably too early to say whether the evidence is there or not to support it being part of NHS services, and that would be a question that would be set at a more national level. So again, absolutely have my sympathy, and if people are finding benefit from these things, then that's all great that people are taking that opportunity, and you know, I'm not saying that you shouldn't do that, but at the moment the NHS can't support those kind of therapies, unfortunately.
Okay, thank you both for those replies. Moving on to a different topic now, I've had one come in about learning disabilities and annual checks. And it's asking about health outcomes for adults with learning difficulties, specifically are considerably poorer than those without. Can the panel update us on current policy to reduce this inequality? In particular, what is the time frame for introducing annual health checks invites across every health centre? Again, I think Tony or Susan, maybe both of you want to take that one on?
Thanks, Gary. I'm happy to take that one and start answering that. And Susan, if you want to contribute afterwards. I say thank you for the question. I think I'd just start by acknowledging that it's right to point out adults with learning disabilities often experience significant poorer health outcomes compared to the general population, and they are a priority population for providing that annual review. And we know that annual reviews have been shown to offer considerable benefits, so we're not aware of the need to do this to this at-risk population. Whilst it was intended that these annual health checks would be in place across all health centres by the Scottish Government policy by May 2023, it's been really difficult to put this in place in practice, and we're continuing to face some of these difficulties. Thankfully, though, we have invested in more resource, namely an additional learning disability nurse, increasing from 1 to 2 nurses, and the increase in nurse resource should allow us to offer this in a more consistent way. Our consultant learning disability nurse is developing a business case for an app. For those not aware, the process of the annual review is incredibly challenging to complete. There's a huge amount of paperwork involved, and it's not the fairest process to ask individuals to participate in. So looking for ways to make this as easy as possible, we're hopefully going to find the outcome of that app, and if it's appropriate for our system, within the next few months. Thankfully, through other resource and investment, the Primary Care Phased Investment Programme, there has been additional nurse resource realised within NHS Shetland, particularly across our general practices, and some of that should be able to facilitate access to this as well, and that may mean that we have to go ahead with using the paper-based process rather than that, depending on that work. So I really just want to be clear that we are prioritising this population. Achieving this work has been really difficult in a small system, but we are looking for ways to make it both easier for the people who need to access this service, whilst continuing to prioritise access to our existing small learning disability nurse resource that we have already. I'd ask that anybody who has any questions to come forward and speak to the colleagues that they have contact with, either in the council services or the NHS services. Just want to thank as well the good work that's been done across information teams within NHS Shetland and the council, that they have identified the people who are on both of our caseloads to make sure that we've got the systems up to date and that we're in a good position to be able to deliver this.
Thanks, Tony. Susan, do you want to add to that?
Yes, thanks very much. Yeah, as Tony said, people with learning disabilities generally often have poorer health outcomes for many reasons. Sometimes that's because of the particular conditions they may have, and sometimes it's about access to services. There's two specific areas I just wanted to mention that my teams are particularly involved with. One's around vaccinations. So the vaccination team does a lot of work working with the learning disabilities team to make sure that we that people with learning disabilities can access vaccinations if they want them, in a place and at a time and in a manner that suits them, because there can be quite difficult for people to have vaccinations, and especially people who may have learning disabilities. So we've done a lot of work around that and have had some really good results and good uptakes with that. And the other area is around screening programs. So last year, one of our team did a project around inequalities in screening in relation to learning disabilities and people with autism, and did a lot of work understanding what barriers there might be for people accessing screening services. So that's primarily the cancer screening services, and some recommendations around that. So we're taking that forward to make sure that anybody who is eligible to access screening services can do that, whether or not they have a learning disability. And if there are particular things that we need to do to make it easier for people to access them, we're looking at how we can put those in place. And this overlaps with some of the other areas of work that Brian was talking about around stigma, trauma-informed practice, these sorts of things as well, and personalised care. So just to say that this is one particular a group of people that we've looked at particularly closely to trying to improve things for people with learning disabilities around accessing those services. Thank you.
Thank you, Susan. A couple more questions that have come in. The first one is around what's the latest of the Gilbert Bain Hospital replacement project. I've touched on that a little bit earlier, but it is the case that the project is still on pause, and we await the review that the Scottish Government is conducting. We expect that to take place in December, so we should hopefully hear more after the outcome of that review. But as I said earlier, I think it's a case of when and not if it'll happen, but hopefully we'll know more by the end of the year. And then the last one I've got at the moment is how is NHS Shetland's attempts to reduce its reliance on agency workers going? Has there been much of a reduction in agency spend, and how has that been achieved? I'm not sure. Kathleen, can I put you on the spot with that one?
Thanks, Gary. Happy to say a little bit
Yep,
about that.
thanks.
So the reasons that we've got supplementary staff in the system are sort of wide and varied. We've seen the number of patients who are complex or frail increase, particularly since the pandemic. We're trying to build multi-professional teams, as Brian said, so that has created new vacancies, perhaps on top of existing turnover. And there are reasons why some of our workforce are not there, such as maternity leave, and those gaps need to be covered, particularly for teams where there are highly specialised roles and we need to continue to access agency staff. But some of the ways in which we've reduced our reliance on agency nursing and in our medical workforce include some new models that we've developed, particularly for consultant roles. So we've got a number of rotational models now in place that in 23-24, we had some successful recruitment in our obstetrician gynecology team, additional emergency physicians, and we also developed a new model, if you like, for surgery that was part of succession planning and has meant that there's a number of new consultant surgeons who've joined the team over the last 12 months. In terms of nursing, we have done a number of things. We've been working very closely with academic partners to help grow our own nursing workforce. We've also been successful in attracting a number of newly qualified nurses who trained elsewhere in Scotland. And we had our first 3 international graduates join us last year who have come from North America, Europe and Africa. And now we've got a number of international graduates that are in our workforce, which is helping us to reduce our reliance on agency spend. So in 2022, then we were spending approximately £180,000 a month on agency nursing. And then by the end of March 24, that had dropped down to 94,000. And we've seen similar shifts in medicine. So I hope that gives a sense of some of the work that sits behind some of those big numbers that Brian quoted earlier.
Thanks, Kathleen. I'm not sure, I've not seen any other questions come in. Carolyn, oh, sorry, Brian's one. Brian, do you want to come in?
There was a post in the chat, Gary, around about the hyperbaric chamber that I think you had alluded to, but I don't think the question was answered.
I can come in on that. So Pierre's put in the chat that it was around the use of the existing chamber, which could be reinstated by volunteers. MS patients are the biggest target. And I guess, again, my answer would be really similar, Pierre, in terms of the evidence for hyperbaric treatment in MS. It isn't at a level that, again, that the NHS has included it in any of the guidelines. So a nice review that's been done. NICE is the English organisation that reviews new treatments and medications. Recently, the review didn't find enough evidence to support its use. So again, it isn't something that the NHS could support, but that again doesn't negate the possibility that other people could look at that as an option for themselves. Hyperbaric therapy doesn't come without risk. So obviously you're putting your body under pressure. So there are consequences of that in terms of pressure on those air-filled spaces, such as the ears and the lungs and other things. So people would need to take their own risk around that. But again, isn't something that the NHS would support at this time.
Okay, thank you.
Thanks, Kirsty. So I'm seeing. Carolyn, do you have any more questions that have come in?
No, I was just saying now might be an opportunity to see if there's any questions from anyone in the meeting.
Yeah, okay.
And just to make the point that we couldn't answer patient-specific ones in a public forum, but we will get back to people out with this if necessary.
Yeah. And I should probably say that there's a number of ways of doing that. You can do it through the Care Opinion website. If you just Google Care Opinion, then you should be able to find that one fairly easily. And then the other one comes directly to us, and that's the email address shet.feedbackandcomplaints@nhs.scot. So there's only one dot in that, so it's shet, SHET .feedbackandcomplaints@nhs.scot, and there's a telephone number as well if you want to phone us, which is 01595 918 286. Happy to take any questions in the meeting if you've got it. Amy's helpfully put a link to that to Care Opinion in the chat there, and Carolyn's got the feedback and complaints email address, so that's good. Do we have any questions? Either put your hand up or put your camera on so that I can see you. Oh, I see a question come in from Joyce Davis. In relation to complaints, as just mentioned, how many current active complaints are delayed, or is this only available to ask as a freedom of information request? Carolyn, do you have up-to-date information around that?
I couldn't give you the specific figures off the top of my head, but we are experiencing pressure answering our stage 2 complaints in particular. So that's a conversation we had at a clinical governance committee meeting just a couple of weeks ago. There's some pressure in the system, and it's the same small handful of people that investigate complaints. And so, yeah, there are a number of the stage 2s that are going longer than the 20 working day response time that we'd hoped for.
Yeah. I think the annual report came to our last board meeting, so there is published information there, so it doesn't have to be a freedom of information request. The information certainly up to the year end is in that report that went to the board, and that'll be on our website. Any other questions? Happy to pick up questions in the chat if anybody wants to drop in there. Just a note there again from Amy to say that the recording of this meeting will be uploaded on the website tomorrow, and there's a link there as well to where you can find that. No, I'm not seeing any hands going up or any other questions dropping into the chat. But again, just a reminder, if you do have a burning question that hasn't been answered here today, then by all means just email that into us and we'll do our best to get the answer for you. And that goes whether it's a sort of individual question about your own care or a more general question. If that comes in the email, then we can deal with that appropriately. Okay, if there's no more questions, then I'd just like to thank you all for attending this afternoon. I think it's been really helpful, hopefully, to be able to share information about the work of the board and what we hope to do as we look forward to this year and coming years. But thank you all for attending this afternoon, and by all means, if you wish to get in touch, then the links are in the chat there, so you should be able to contact us. Thank you very much.